The sterile air in St. Jude's operating theater was thick with unspoken dread. Beneath the harsh surgical lights, young Kaito Ishikawa's fragile life teetered on the brink, his deep cerebral aneurysm a ticking time bomb. Dr. Anton Kovic, chief neurosurgeon, gritted his teeth, his standard approach failing with each agonizing minute. The monitor's relentless beeps escalated, mirroring the rising panic in the room, threatening to shatter Kaito's last chance. Rookie nurse Aisha Ndidi, a quiet shadow at the edge of the organized chaos, saw it, a subtle vascular tremor missed by the seasoned team. Her breath hitched. A hushed, almost imperceptible suggestion began to form on her lips, a flicker of combat-honed insight. Before the words could fully materialize, Kovic's cutting gaze pierced her. "Nurse Ndidi, your commentary is neither required nor welcome. Stick to your duties." The dismissal stung, a public rebuke, but beneath the shame, a defiant resolve hardened. No one else saw the path to saving Kaito. She did. And she would find a way. The sterile hum of St. Jude's Apex Medical Center's state-of-the-art operating theater was usually a backdrop for triumph. Today, it was a menacing drone, vibrating with every failed attempt, every rising dread. This was an institution of titans, where the best brains and steadiest hands carved futures from the brink of oblivion. But even here, Kaito Ishikawa's young life was slipping through the polished fingers of its chief neurosurgeon. Dr. Anton Kovic, a man whose reputation for brilliance was matched only by his formidable ego, was visibly faltering. Sweat beaded on his brow, catching the harsh lights. His movements, usually fluid and confident, were becoming jerky, laden with frustration. The deep cerebral aneurysm, obstinate and malicious, refused to yield to his celebrated technique. Each delicate maneuver, each attempt to stabilize the fragile vessel, was met with an alarming spike on the monitors. A collective held breath followed every failed push, every subtle tremor that threatened Kaito's last thread of life. Rookie nurse Aisha Ndidi, her gaze unblinking behind her mask, absorbed every detail. The unspoken tension in the room was a palpable weight, pressing down on everyone, but Aisha saw beyond the general anxiety. She watched Kovic's hands, the instruments, the minute fluctuations on the screen. She registered the subtle, almost imperceptible pulsation that betrayed a deep, structural instability, something beyond the usual complexities of such a case. It was a pattern she knew, a ghost of past battles fought in far more unforgiving landscapes than this pristine operating room. Her gut clenched. The standard approach wouldn't work. It was actively making things worse. She shifted slightly, preparing to offer a quiet, contextualized observation, when Kovic's voice, sharp and laced with the bitterness of failure, sliced through the air. "Scalpel. Again. And for the love of all that is holy, someone stabilize this field." He slammed a gloved fist onto the instrument tray, the sudden clang echoing like a gunshot in the hushed chamber. The scrub nurse flinched, but Aisha remained motionless, her resolve hardening even as Kovic's dismissive glare swept over her, a harsh reminder of her previous rebuke. Dr. Sterling Hayes, the senior surgeon assisting Kovic, a man known for his pragmatic approach, cleared his throat. "Anton, perhaps a moment to reassess? The vitals are dipping further." He spoke with a carefully measured tone, a subtle challenge to Kovic's authority veiled as a suggestion. Kovic scoffed, not even looking at Hayes. "Reassess what, Sterling? That a young internist believes he can tell me how to handle a grade 4 aneurysm? I've done 1,000 of these. It's simply uncooperative." His eyes, dark and narrowed, landed on Aisha for a split second, as if blaming her mere presence for the aneurysm's defiance. The message was clear, no input from the junior staff, least of all a nurse. Aisha felt the sting, but it was overshadowed by a rising panic for Kaito. The boy's pale, innocent face flashed in her mind. He was failing. She saw a flicker on the monitor, a subtle, almost rhythmic pulsation that indicated a deeper issue Kovic was missing in his mounting frustration. A risky, unconventional maneuver was forming in her mind, a technique honed not in textbooks, but under fire, in places where sterile protocol was a luxury. She stepped forward, just a fraction, her voice barely above a whisper. "Dr. Kovic, with respect, I believe the proximal pressure, it's causing a micro-oscillation. If we could adjust the angle of approach, perhaps a wider arc tether. Before she could finish, Kovic erupted, his face reddening with fury. Adjust the angle? A wider arc tether? He ripped off his surgical mask, his voice booming across the stunned room. Nurse Ndidi, you are a nurse. Your duties involve assisting, not diagnosing or dictating surgical strategy. Are you implying I am somehow missing something? His laugh was short, sharp, and entirely without humor. Perhaps you'd like to take over? Or did they teach advanced neurosurgery in whatever backwater institution awarded you your nursing degree? The humiliation burned, a wave of heat rising to Aisha's ears. The room was silent, every eye now fixed on her, some with pity, others with a chilling understanding of Kovic's wrath. Dr. Hayes shifted uncomfortably, but said nothing. Aisha felt the weight of the rigid hierarchy, the unyielding pecking order of St. Jude's apex, crushing her impulse to speak. But through the shame, Kaito's weakening heart monitor pulsed, a drumbeat of desperation, igniting a quiet fury within her. She bit back the retort, her jaw clenching. They couldn't see it. But she could. And Kaito didn't have much time left. The rhythmic beep of the cardiac monitor, once a steady presence, now felt like a taunt, each pulse a reminder of Kaito's precarious state. Kovic, his face a mask of furious concentration, ignored Aisha completely, his attention fixated on the delicate dance unfolding on the monitor. His fingers, usually so precise, seemed to falter, betraying a frustration that was visibly mounting with each failed attempt to secure the aneurysm. He was trying to reclip, attempting to adjust the first, ill-placed clip, but the tissue was already stressed, the blood flow erratic. Aisha's gaze, sharpened by years of battlefield triage where every second counted, tracked the subtle ripple patterns on the cerebral angiogram. Her mind, disengaged from the immediate humiliation, was already racing through probabilities, identifying patterns Kovic, and his tunnel vision, seemed to be missing. The vessel was already under immense strain. Kovic's forceful, almost aggressive adjustments were only increasing the pressure, not relieving it. He was trying to push through brute force what required finesse. Retractor here, firmer. Kovic snapped at the surgical assistant, his voice laced with an impatience that bordered on desperation. He leaned in closer, his brow furrowed, a bead of sweat tracing a path down his temple. The delicate instruments in his hand trembled ever so slightly, a tremor that spoke volumes of his waning control. He attempted another adjustment, a bolder, more decisive move, aiming to clamp the elusive vessel once and for all. Aisha's breath caught in her throat. Her eyes were glued to the screen, to the minute distortion forming just beyond the target site, a subtle bulge that signified impending disaster. Dr. Kovic, wait. The words escaped her lips, a desperate gasp, before she could fully censor herself. The distal anastomosis, it's dilating. You're putting too much pressure on the adjacent arteriole, there's a risk of collateral rupture. Kovic froze, his hand still poised over Kaito's exposed brain. His head snapped up, eyes blazing, not with comprehension, but with incandescent fury. What did you just say, Nurse Ndidi? His voice was a low growl, more dangerous than any shout. The entire room went utterly silent, the only sound the increasingly frantic beep-beep-beep of the monitor. Even Dr. Hayes winced, shrinking back. Are you presuming to instruct me on vascular anatomy in my operating theater? I just told you, your role is to assist, not to invent new forms of diagnosis. He scoffed, turning back to the patient with a dismissive wave. The distal anastomosis is perfectly stable. Focus on handing me the next clamp, nurse. But it wasn't. Aisha's stomach lurched as she watched the monitor, helpless. Kovic, ignoring her, proceeded with his intended, aggressive maneuver. There was a sickening, almost imperceptible shift on the screen, a sudden blanching of the tissue, then a horrifying, crimson cloud blooming into view. No! Aisha cried out, a guttural sound torn from her throat. A collective gasp swept through the room. The cardiac monitor's frantic beeping escalated into a sustained, piercing shriek. Kaito's blood pressure plummeted, alarms blared, and the anesthesiologist barked urgent commands about vasopressors and fluid boluses. A rogue bleed, small but immediate and dangerously close to a critical brainstem, was now gushing, obscuring Kovic's view, threatening to flood the surgical field and make the original aneurysm problem exponentially worse. Kovic staggered back from the table, his face ashen, the color draining from it faster than blood from the wound. His earlier arrogance had evaporated, replaced by a raw, naked panic. "Damn it! What happened?" he stammered, his voice thin, high-pitched. He looked bewildered, as if the fault lay with the patient, or the instruments, or the universe itself, but certainly not with him. Dr. Hayes surged forward, his usual calm shattered. "It's a secondary hemorrhage, Anton. A collateral tear. Just like Nurse Ndidi said." He pointed a trembling finger at the monitor, then at Aisha. "She saw it coming. She warned you." The operating room, moments ago controlled and sterile, was now a maelstrom of fear and frantic activity. Nurses scrambled, instruments clattered, and the incessant blare of alarms tore through the air. Kaito's life hung by the thinnest of threads, his heart struggling, his brain starved for oxygen. Aisha, though outwardly calm, felt her own heart hammering against her ribs. The familiar cold dread of a critical, rapidly deteriorating patient washed over her, a visceral memory from dusty, blood-soaked fields. She knew this feeling. She knew this moment. Kovic, for all his prestige, was faltering, lost in the sudden chaos. His hands, which had moments ago been so dismissive, were now visibly shaking. "Get the suction!" Kovic yelled, his voice cracking. "I can't see. I can't find the source." He was flailing, losing precious seconds. Desperation clawed at Aisha. Kaito was dying. She could see it in the monitors, in the anesthesiologist's grim face, and Hayes's frantic, pleading gaze at Kovic. The rigid hierarchy that had held her silent for so long, the fear of professional ruin, suddenly seemed utterly irrelevant. All that mattered was the young life slipping away on the table. She knew what to do. She had to make them listen. This moment for Aisha, on the cusp of risking everything, reminds us all how often true brilliance is overlooked, simply because it doesn't fit expectations. Haven't we all felt like the underdog, struggling to be heard? If her fight for Kaito's life resonates with you, and you believe in the power of hidden heroes, we invite you to join our growing global community. Your subscription is more than just a click. It helps us bring more incredible, heartwarming, and thought-provoking stories like Aisha's to life. Become part of us, and let's celebrate these triumphs together. We truly appreciate your support. The world narrowed for Aisha. The monitors blared a frantic, escalating rhythm, each beep a hammer blow to Kaito's dwindling chances. Kovic's frantic flailing, his desperate, unseeing probes, were a terrifying echo of moments she knew all too well, moments where a life hung by a thread, and indecision meant doom. The sterile operating theater, with its gleaming steel and hushed protocols, blurred into a memory of dust-choked desert tents and the raw, guttural cries of men fighting for air. The cold dread that had washed over her was now a searing blaze of purpose. Her career, her position, the scorn of Kovic, all of it evaporated like smoke. All that remained was Kaito, his young life flickering, and the undeniable truth burning in her mind. She knew how to save him. The fear of breaking protocol, of unleashing Kovic's fury, of facing the inevitable professional ostracization, was still a dull ache in her gut. But it was drowned out by the roar of a different fear, the terror of inaction, of letting this boy die when she held the key. This was not St. Jude's, this was the battlefield, and a soldier was going down. Her voice cut through the rising panic, clear and steady, a low command rather than a request. "Dr. Kovic, retract the microcatheter. You're creating a false lumen. Pressure. Anterior superior approach, 4 degrees medial. There's a collateral branch superior to the aneurysm, it's occluding your view." The words hung in the air, potent and unexpected. The room, already stunned by the glint of the Purple Heart against Aisha's pale skin, froze even deeper. Kovic's head snapped up, his eyes, wild with panic moments before, now burning with disbelief and outrage. "Ndidi. What in God's name?" he began, his voice a dangerous growl, but Aisha didn't flinch. She met his gaze, not with defiance, but with an unwavering certainty that brokered no argument. Her own eyes, usually humble and downcast, now held the sharp, assessing intensity of a seasoned commander. "His cerebral perfusion is dropping, Doctor. The internal carotid is already compromised by the microemboli from your previous attempt. You need to clear the field. Now." Her voice was still calm, but it vibrated with an authority no one had ever heard from the quiet rookie nurse. She wasn't asking, she was directing. Dr. Hayes, who had been watching Kovic's descent into panic with growing desperation, saw the flicker of truth in Aisha's eyes, the unshakable confidence that felt like an anchor in the storm. The Purple Heart, that stark symbol of sacrifice and grave injury, was no longer just a shocking reveal, it was an explanation, a testament to a depth of experience no one had ever suspected. Hayes, desperate, made a split-second decision. He moved closer, placing a hand on Kovic's shoulder, a subtle pressure. "Anton," he said, his voice low but firm, "she's right. Listen to her." Kovic stared, caught between his ingrained arrogance and the undeniable evidence of his own failure. His hands were still shaking, his mind struggling to process the nurse's audacity, yet the words she spoke, the precise anatomical directions, were ringing with a terrifying logic. He looked at Kaito, then back at Aisha, who was now holding his gaze with an intensity that demanded compliance. Her face was serene, devoid of emotion, a mask of pure focus. "Microcatheter, retract," Aisha repeated, her voice a shade softer, but no less commanding. Slowly. Then, a quick, gentle aspiration to clear the immediate field. "Prepare a smaller gauge, curved tip. We need to access the posterior communicating artery, not the anterior." Kovic, his movements stiff, almost robotic, began to comply. The internal struggle was etched on his face, a raw battle between his ego and his medical oath. Every fiber of his being screamed against taking orders from a nurse, especially this nurse, but his hands, guided by a primal instinct to save the patient, followed her command. He retracted the catheter, and the suction nurse, already anticipating Aisha's next instruction, had the aspiration ready. A delicate, bloody mist cleared, and for the first time in minutes, a clearer view emerged. Aisha moved slightly, her eyes never leaving the monitor, her body language subtly shifting from observation to active leadership. She was no longer just a nurse, she was a combat medic back in the fight, her training, her instincts, her every fiber tuned to the critical moment. The fear was gone, replaced by the exhilarating, terrifying clarity of absolute purpose. This was her element, a high-stakes dance with death, and she was leading. "Microembolism risk, Dr. Kovic. 3 o'clock position, approximately 2 mm distal to your current focus. There's a faint, aberrant branch, almost imperceptible, that's being stressed by the flow. If we proceed as planned, it will shear." Aisha's voice, a steady, low current, cut through the tension. Her gaze was locked on the high-definition monitor, discerning a detail so minute, so fleeting, that it had eluded the collective, trained eyes of some of the nation's top neurosurgeons. Kovic's hand, poised to advance the catheter, froze. His brow furrowed in a mixture of disbelief and a nascent, unwelcome doubt. He squinted at the screen, then leaned closer, his breath hitched. He saw nothing. Or rather, he saw what he expected to see, not what Aisha was pointing out. "Nonsense," he scoffed, his voice thin, lacking its usual boom. It was a reflex, a desperate attempt to reassert control, but it was hollow. The image of the Purple Heart, still etched in his mind's eye, a stark, metallic counterpoint to his dismissive tone, made his protest ring false even to his own ears. "It's subtle, sir. An undeveloped anterior communicating artery variant, prone to spasm under pressure. Military trauma research identified this variant as a critical vulnerability in blast injuries involving rapid intracranial pressure changes. It requires a gentle redirection of flow, not a direct approach." Aisha spoke with the quiet authority of someone recalling a textbook, yet her words carried the weight of direct, brutal experience. She wasn't quoting theory, she was relaying hard-won knowledge, paid for in blood and sacrifice. Dr. Hayes, who had been holding his breath, let it out in a slow, almost inaudible sigh. He leaned in, his eyes scanning the monitor where Aisha indicated. He still couldn't see it clearly, but the unwavering certainty in Aisha's voice, combined with the inexplicable precision she had already demonstrated, compelled him. "Anton," he urged, his voice low, "divert. Follow her lead." Kovic's jaw tightened. Every fiber of his ego screamed in protest. To accept this was to concede not just skill, but a fundamental understanding of anatomy that he, Dr. Anton Kovic, chief neurosurgeon, had spent decades perfecting. Yet, the patient on the table, Kaito, was fading. The rhythmic beep-beep-beep of the heart monitor was now punctuated by a more urgent, sporadic pulse. The stakes were too high for pride. With a grunt that was more surrender than assent, Kovic subtly adjusted his grip. "How?" he clipped, his eyes still attempting to dissect the anomaly Aisha had described. "Rotate the catheter 3 degrees anti-clockwise, then advance fractionally, 1 millimeter at a time, using the anterior wall as a guide," Aisha instructed, her voice calm, devoid of triumph. "Maintain that angle until you feel the resistance lessen. Then, hold." The operating room was a tableau of frozen disbelief. The scrub nurse, the circulating nurse, the anesthesiologist, all watched Aisha, then Kovic, their faces mirroring a mixture of awe and bewilderment. They were witnessing a reversal of hierarchy, a quiet coup orchestrated by a rookie nurse whose calm competence was shattering decades of ingrained medical orthodoxy. Kovic, a surgeon famed for his decisive, almost aggressive technique, moved with a hesitant, almost delicate precision he rarely displayed. His hand trembled slightly, not from lack of skill, but from the immense internal friction of yielding control. He rotated the catheter. 1 millimeter. Another. His eyes flickered between Aisha's steady gaze and the monitor. Then, a flicker. A minute tremor on the screen, a subtle shift in the blood flow pattern. It wasn't a dramatic change, but to the trained eye of a neurosurgeon, it was an undeniable confirmation. The faint, aberrant branch Aisha had described, now released from stress, seemed to almost breathe. The microembolism risk, previously invisible to him, suddenly became horrifyingly clear. It was there, just as she had said. A wave of cold dread washed over Kovic, instantly followed by a profound, chilling respect. He had been minutes, perhaps seconds, away from a catastrophic error, an oversight that would have cost Kaito his life and stained Kovic's record forever. This young nurse, this combat medic with a hidden purple heart, had seen what he, with all his experience and accolades, had missed. The air thrummed with unspoken questions, with dawning realization. Dr. Hayes, watching Kovic's face, saw the flicker of acknowledgement, the first crack in the granite facade of his friend's pride. He felt a surge of validation, not for himself, but for Aisha, for the desperate chance he had taken. This wasn't just luck, this was profound, intuitive genius. This was the raw, unpolished brilliance forged in the crucible of war, now shining in the sterile theater of St. Jude's apex. The danger remained high, but the path forward, now guided by an unexpected beacon, felt infinitesimally clearer. The operating room, once a crucible of Kovic's unyielding authority, transformed into a delicate ballet choreographed by Aisha's whispered directives. Each instruction, calm and precise, felt like a feather-light touch guiding a heavy hand. "Dr. Kovic," she murmured, her voice steady as a heartbeat, "the medial perforator is showing signs of spasm. A 5-degree lateral adjustment, then a fractional anterior shift. Approach from the ventral aspect. The posterior communicating artery requires a slightly steeper angle than you'd typically initiate." Kovic, a man who built his career on absolute control, found himself a marionette to Aisha's invisible strings. His brow was furrowed in an intense concentration he rarely displayed, a sweat bead tracing a path down his temple. His hands, usually so confident, now moved with a newfound, almost hesitant deference, executing the bizarre, counterintuitive maneuvers Aisha called out. He didn't question, he followed. The arrogance was gone, replaced by a desperate, all-consuming need to succeed, illuminated by the stark reality of Aisha's earlier, life-saving intervention. He could feel the fine tremor in his fingers, not from fatigue, but from the raw, unsettling realization of his dependence. Dr. Hayes watched, a silent observer holding his breath. He saw Kovic's jaw tighten, heard his almost imperceptible grunt of effort, and understood the seismic shift occurring within his colleague. This wasn't merely compliance, it was an act of profound, if grudging, surrender to superior insight. Aisha didn't just offer suggestions, she laid out a precise, three-dimensional map of a vascular labyrinth Kovic had navigated countless times, yet had never truly seen. The atmosphere in the room was thick with a tension so palpable it felt like a physical weight. Nurses and anesthesiologists, usually focused solely on their own tasks, now stole glances at Aisha, then at the monitor, then back at Kovic's meticulous, guided movements. They saw the subtle twitch of Kaito's eyelid on the screen, the flickering vital signs that had been plunging, now holding steady, then slowly, miraculously, beginning a gentle ascent. Now, Dr. Kovic, Aisha's voice was a soft crescendo, signaling the critical juncture. The distal neck of the aneurysm is exposed. Gentle pressure, superior medial. Prepare the clip. You'll need a microangled fenestrated clip, a millimeter shorter than standard for this morphology. There's a microcalcification point on the inferior wall, avoid direct contact. Kovic's eyes, magnified by his loops, darted to the indicated point. He saw it. A minuscule speck, almost invisible, that would have compromised a standard clipping. His hand, guided by Aisha's precise trajectory, moved with a grace born of decades of practice, now infused with the sharpened focus of absolute necessity. Click. A collective, silent gasp rippled through the room. The sound of the clip engaging was almost imperceptible, yet it resonated like a thunderclap. On the monitor, Kaito's vitals, which had been dancing on the edge of disaster, steadied instantly. The irregular spike patterns smoothed into rhythmic waves. His brain activity, once chaotic, began to normalize. A profound, heavy silence descended, broken only by the soft beeping of the monitors. For a long, agonizing moment, no one moved, no one breathed. Then, Dr. Hayes let out a long, shuddering exhalation, his shoulders slumping in a wave of overwhelming relief. His eyes met Aisha's over Kovic's bowed head, a silent acknowledgement passing between them, a profound sense of triumph. Kovic slowly straightened, his instrument still in hand. He looked at the monitor, then at the microscopic field, then at Aisha. His surgical mask hid the bottom half of his face, but his eyes, usually cold and imperious, were wide, reflecting a storm of emotion, disbelief, exhaustion, and an undeniable, searing respect. He didn't speak, couldn't. The words were trapped in his throat, overwhelmed by the tidal wave of release that washed over him. The impossible had been achieved. Kaito was saved. A nurse, who had been silently assisting, felt tears well in her eyes. Another reached out and gently squeezed Aisha's arm, a small, trembling gesture of gratitude and awe. The entire room seemed to sag, as if the very air had been holding its breath for an eternity and could now finally exhale. Kovic carefully placed his instruments down. He removed his loops, then slowly, deliberately, pulled down his mask. His face was pale, lined with exhaustion, but his eyes, fixed on Aisha, held a depth of emotion she hadn't thought him capable of. His lips parted, but no sound came out. Instead, he simply nodded, a slow, almost reverent inclination of his head. It was more than an apology, it was an admission, an acknowledgement, a profound, unshakable validation. The chief neurosurgeon, Dr. Anton Kovic, had just bowed to a rookie nurse. The surgery was complete. Kaito Ishikawa had a future. The surgical suite, once a crucible of frantic energy and concentrated dread, now sagged under a profound, almost sacred quiet. Kovic's bowed head, a gesture utterly unthinkable minutes prior, was the final stroke on a canvas of disbelief and dawning comprehension. The air, heavy with the metallic tang of sterilizing agents and the faint scent of fear, now shimmered with an entirely new emotion, awe. Dr. Sterling Hayes was the first to break the spell. He walked slowly, deliberately, towards Aisha. His face, usually a mask of professional stoicism, was now an open book of wonder and relief. He reached out, not for her hand, but gently, almost reverently, touched the gleaming metal peeking from her collar. His gaze, however, was fixed on her eyes, dark and calm, mirroring the deep pools of experience he now understood they held. "A purple heart," he whispered, the words barely audible, yet resonating with immense weight in the hushed room. His thumb traced a sharp, distinct outline of the metal. "From where, Aisha?" Aisha felt a blush creep up her neck. She hadn't meant for it to be seen, not like this, not ever. It was a part of her past, a heavy, cherished burden she carried privately. She instinctively reached to reclip her collar, to hide it again, but Hayes's hand, though light, prevented her. He wasn't accusing, he was seeking understanding. "Afghanistan," she replied, her voice soft, almost apologetic, as if confessing a secret. "A few tours." The word hung in the air, instantly painting a vivid picture in the minds of everyone present. Afghanistan. Combat. Trauma. The impossible conditions, the brutal realities. Suddenly, her uncanny precision, her radical improvisation, her unshakable calm under pressure, it all clicked into place with a staggering, undeniable force. She wasn't just a nurse, she was a combat medic. Not just a medic, but one who had seen, done, and endured things few civilians could even imagine. The other nurses, who had witnessed her quiet brilliance, now looked at her with a mixture of pride, respect, and a protective tenderness. Nurse Chen, who had initially been skeptical, now approached and enveloped Aisha in a fierce hug. "We never knew," she murmured, her voice thick with emotion. "You saved him, Aisha. You saved Kaito." But it was Kovic's gaze that held the most profound transformation. He had slowly walked towards them, his mask still lowered, revealing a face stripped of its usual arrogance. His eyes, though still intense, held no trace of disdain, only an almost reverent respect. He hadn't just been humbled by her skill, he had been utterly undone by the revelation of her sacrifice. "Afghanistan," Kovic repeated, his voice raspy, a stark contrast to his usual booming authority. He looked at the metal, then at Aisha, then back at the metal, as if trying to reconcile the unassuming rookie nurse with the weight of that decoration. That means you faced more than just academic challenges, doesn't it?" Aisha simply nodded. She didn't elaborate, didn't boast. She didn't recount the firefights, the desperate improvisations with makeshift tools, the lives saved under extreme duress, the friends lost. She didn't speak of the moment the shrapnel tore through her, the pain, the recovery, the quiet determination to continue serving, even if it meant trading a war zone for a sterile hospital. The Purple Heart spoke volumes without her needing to utter a single word. It revealed a core of resilience, courage, and selfless dedication that went far beyond any medical degree. It revealed the depth of her character, forged in the crucible of unimaginable hardship. "You didn't just save Kaito today, Nurse Ndidi," Kovic continued, his voice regaining some strength, but infused with a new, sober gravitas. "You reminded us all of what true courage looks like. And what true expertise truly means." His gaze swept across the room, encompassing every stunned, respectful face. "And for that, we are all indebted to you." His words were not a formality, they were a heartfelt confession, a public acknowledgement of his own fallibility and her undeniable, profound mastery. The hierarchy of St. Jude's apex, rigidly defined by titles and years of service, had just been irrevocably altered. Aisha Ndidi, the rookie nurse, had not only earned her place but had redefined it, not through ambition or assertiveness, but through quiet, selfless heroism. Her validation was complete, etched not just in the successful surgery, but in the humbled admiration of her peers and superiors. Despite the overwhelming attention, Aisha remained grounded, a quiet strength radiating from her, a testament to the fact that her service was never about recognition, but simply about saving lives. Kaito Ishikawa's recovery was nothing short of miraculous. Days turned into weeks, but the critical young man, once on the precipice of an irreversible abyss, slowly, steadily clawed his way back. His parents, initially numb with terror, became almost overwhelmed with relief and gratitude, their eyes welling up every time Aisha passed their son's room. Kaito's mind was intact, his motor functions returning with diligent physical therapy. He would eventually walk out of St. Jude's, a living testament to the combined efforts, but primarily to the unlikely intervention of a quiet nurse. His discharge was a quiet triumph, a collective exhale of breath for the entire neurosurgery department, a stark contrast to the dramatic tension of his emergency surgery. The ripple effects of that day, however, extended far beyond Kaito's bedside. Dr. Anton Kovic, the chief neurosurgeon, had been profoundly shaken. The initial humiliation had curdled into a bitter pill to swallow, but as Kaito's prognosis improved, it began to dissolve into a reluctant, then profound, introspection. Kovic was still Kovic, brilliant, demanding, and meticulous, but something essential had shifted within him. He was quieter in staff meetings, more inclined to listen. The edge of his dismissiveness had dulled, particularly towards nurses and junior staff. He began to ask questions, not rhetorical ones designed to assert his authority, but genuine inquiries, seeking input. One afternoon, he surprised everyone by proposing a new interdisciplinary grand round session, specifically inviting nurses, techs, and even paramedics to present on unique field experiences or overlooked patient observations. His gaze, during the announcement, had lingered on Aisha for a fraction of a second too long for it to be coincidental. He never apologized directly for his prior behavior, not in words anyway, but his actions spoke volumes. He started treating every member of his team, from the most junior resident to the seasoned scrub nurse, with a newfound, if sometimes gruff, respect. He saw their skills, their contributions, not just their titles. For Dr. Anton Kovic, the transformation was a profound, deeply personal evolution, from an unassailable god of the operating room to a leader who recognized the fallibility of even the most brilliant mind, and the immeasurable value of a collective, diverse expertise. Dr. Sterling Hayes, already a pragmatic and observant surgeon, found his perspective cemented and broadened. He became a quiet, powerful advocate for a more collaborative approach within the hospital. He pushed for protocols that explicitly allowed for a wider range of voices in critical situations, referencing the unforeseen benefits of diverse experience with a knowing look that everyone now understood. Hayes became Aisha's staunchest, unspoken champion, ensuring her insights were no longer overlooked and subtly guiding opportunities her way. He often sought her out for quiet consultations on complex vascular cases, valuing her unique ability to visualize intricate anatomical challenges under pressure. Aisha Ndidi, however, remained steadfastly herself. The spotlight had briefly glared, but she recoiled from its heat, preferring the quiet satisfaction of her work. She still arrived early, still tended to her patients with that same gentle diligence, still maintained her humble demeanor. Yet, everything around her had changed. The hushed whispers that followed her through the corridors were no longer speculative or dismissive, but filled with awe. Colleagues, once distant, now greeted her with genuine warmth and respect. Junior nurses approached her for advice, not just on medical procedures, but on navigating the demanding environment of St. Jude's. Senior physicians, once accustomed to barking orders, now paused, often asking for her opinion, or simply acknowledging her presence with a respectful nod. She wasn't made a neurosurgeon, nor did she seek to be. Her calling remained at the bedside, in the quiet observation, in the precise, empathetic care that defined her. But her voice, once ignored, now carried weight. Her suggestions, once scoffed at, were now considered with serious deliberation. The hospital, St. Jude's Apex Medical Center, with its formidable reputation and rigid hierarchy, began to subtly, gradually, bend. It was a change measured not in dramatic policy overhauls, but in the nuanced interactions, the newfound openness to listen, the collective understanding that true strength lay not just in individual brilliance, but in the tapestry of diverse skills and experiences. Aisha continued her work, her Purple Heart medal now carefully tucked away, a private symbol of a past she carried with quiet dignity. The incident had not just saved Kaito Ishikawa's life, it had cracked open the established order, allowing a ray of hope for a future where empathy, diverse experience, And the quiet courage of individuals like Aisha Ndidi were recognized and celebrated as the most vital components of true healing. It was a powerful testament to human growth, a reminder that even the most entrenched systems could evolve, driven by a moment of unexpected heroism and the enduring power of respect earned, not granted. The future of St. Jude's, and perhaps the wider medical community, held the promise of a more inclusive, more human approach to medicine, forever touched by the quiet strength of a rookie nurse. Aisha's incredible story is a powerful reminder that true strength, wisdom, and healing often reside in the most unexpected places, challenging our preconceptions and enriching our understanding of human potential. It's a testament to the transformative power of empathy and recognizing diverse experiences. We'd love to hear your thoughts. How do you think embracing hidden strengths can transform your own community or workplace? If this story resonated with you, please consider subscribing and joining our growing global community. Your support genuinely helps us create more compelling, uplifting narratives that celebrate the quiet heroes among us. Thank you so much for watching and being a cherished part of our journey together.